In this lecture, we will describe the anatomical terms. The anatomical terms are used to describe the relation of different structures and organs to each other. It is a proportional relation. Firstly, the median is a structure, is a term used to describe a structure present in the midline of the body, in the median plane of the body, either anterior, to be called anterior median plane, or posterior, to called posterior median plane. Median is the term only which doesn't describe relation of points to each other, but it describes the point which is present in the median plane, either in the anterior median plane or in the posterior median plane. All terms rather than median, as we previously said, are used to describe relations of bodies to each other, of bodies, points, otherwise to each other. Firstly, we will describe the term medial and lateral. Medial and lateral is a term used to describe the relation of two points or two structures with each other. The structure which is nearer to the median plane, this is the median plane. The structure which is nearer to the median plane is called the medial, to the structure which is away from the median plane. So A is medial to B, A is medial to C, but B is lateral to A and medial to C. Then the medial and lateral is a term to describe the relation of two points or two structure to each other. The structure of them which is present nearer to the midline is medial, and that away from the midline is lateral. Here A is medial to B, A is medial to C, B is medial to C but is lateral to A. C is lateral to both A and B. Anterior and posterior describe the relation of two structures or 2 points to each other also. This is a rule rather than the midline or median. All other terms describe the relation of points, of 2 points or 2 structures to each other. Anterior and posterior describe the relation of 2 structures to each other. The structure of them which is nearer to the anterior body wall is anterior to that which is farther away from the anterior. So if we take A and C, C is anterior to A. If point is put here and determined 1 here at the tip of the arrow, it is called, it is anterior to this point. A is anterior to B. C is anterior to D. D is posterior to C. Then the structure which lies close to the anterior body wall is called anterior in relation to a structure which lies away from the body wall in relation to this structure. However, if we see this figure, it is a proportion. A, the point A is anterior to the point B. The point B is anterior to the point C. Point C is posterior to point B. Point D is posterior to all these points. Then it is a proportion. Sometimes, like point C is posterior to B but anterior to D. Also point B is anterior to point C and posterior to point A. It is a proportional structure, superior and inferior. Superior and inferior also describes the relation of 2 points to each other. The point of them which is nearer to the upper end of the body in the anatomical position. But if he inverted side down, no. In the anatomical position, point A is superior to point B. Point B is superior to C. Then superior and inferior is a term used to describe the relation of 2 points to each other, or more than 2 points to each other. The point of which is nearer to the upper end of the body, of course described in the anatomical position, is called superior to that which is away from the upper end. The term superior equal upper and the term inferior equal lower. In the language of embryology, we use a cranial and caudal. Then superior equal upper or cranial, inferior equal lower or caudal, so that point A is superior to point B, point B is superior to C, but point C is inferior to point B. Point B is inferior to point A. Point G is inferior to all these points. Point F is inferior to point D and superior to point G. Okay. Now we will describe what is deep internal, deep or superficial, which equal external. Deep or internal and superficial or external is the relation of 2 points to each other. The point of which is the nearer to the body wall, either anterior body wall or posterior body wall, is called superficial, and the point which is away from the body wall, either anterior or posterior, is called deep. So point C, point 3, we imagine that it is in the skin, is superficial to point here, which is deep inside the body cavity. Point on the skin here, on the posterior body wall. It's superficial to point here on the vertebral column, so that deep or internal and superficial or external describes the relation of 2 points or to each other. Which of these points is nearer to the body wall? And here it is either anterior body wall or posterior body wall is called superficial, and that which is deep is called deep. Yes. Here, palmar and dorsal. Palmar and dorsal are terms used only for the hand. This is the palmar surface of the hand, and this is the dorsal surface of the hand. Palmar is the palm of the hand, point present on the palm of the hand. Dorsal on the dorsum of the hand. And the same as point plantar and dorsal. A plantar is a point on the plantar surface of the sole which touches the ground on the anatomical position. Dorsal is the dorsal surface of the foot. The upper surface of the person lies in the anatomical position or stand in the anatomical position like this. The surface which touches the ground from the foot is called a plantar, and that which appears upwards is called dorsal. Here, this is the dorsal surface of the foot, and this is the plantar surface of the foot. What about proximal and distal? Proximal and distal are terms used to the limbs only, upper limb or lower limb, to describe the relation of 2 points to each other. The point of which, this is the upper limb, this is the lower limb. This is the attachment of the upper limb to the trunk, or this is the attachment of the lower limb to the trunk. The point which is nearer to the attachment of the limb to the trunk is called the proximal, and that which is away from the attachment of the limb to the trunk is called the distal. Then the term proximal and distal describes the relation of 2 points on a limb, either upper limb or lower limb. The point of which is nearer to the attachment of the limb to the trunk is proximal to that which is away from attachment of the limb to the trunk. So that A is proximal to B, A is proximal to C, however C is distal to B, distal to E, but proximal to D and proximal to F. Hence, the nearer the point to the attachment of the limb of the trunk, this point is called as the proximal in relation to a point away from attachment of the limb of the trunk. Also, applying this rule on the lower limb, this is the point of attachment of the limb to the trunk. Point 1 is proximal to point 2. Point 3 is proximal to point 4. However, it is distal to point 2. Point 4 is proximal to 5 and point 5 is distal to all these points on the lower limb. These are the anatomical terms. Anatomical terms point on the median plane. It is either anterior median plane or posterior median plane. Is called the median. Median, like the vertebral column on the back, or linea alba on the anterior abdominal wall, which is at which the umbilicus lies on its middle. While point medial and lateral is describes the relation of 2 points or 2 structures to each other. The point of which is nearer to the midline is medial to that which is away from the midline. Anterior and posterior, the relation of 2 points to each other, the point of which is nearer to the anterior body wall here, the anterior body wall, unlike superficial and deep, is called anterior, and that which is away is called posterior. Superior and inferior, the point which is nearer to the upper end of the body is superior to that which is away from the upper end. Palmar and the dorsal, the palm of the hand, dorsal surface of the hand, dorsum of the hand, a plantar and the dorsal only applied for the foot. Proximal and distal terms used for the limbs only, the upper limb or lower limb, describing the relation of 2 points to each other, the point of which is proximal to, which is nearer to the attachment of the limb to the trunk, is called proximal to that which is away, and the point which is away is distal to that point which is nearer to the attachment of the limb of the trunk. Thank you.